Are you an international RN and want to work in Australian healthcare sector, but you are worried and do not have any courage to join the Australian healthcare sector because you do not have experience or because you have clinical gap or you have only worked in overseas or your home country? Then you should watch this video. Hello guys, this is Reema and welcome back to my channel. I talk about nursing and life. As an international RN with 3 years of clinical gap and only 1 year of experience in my home country, I understand and have gone through all those second thoughts that comes on your mind when you had get registration in Australia and want to join the healthcare system. Currently, I'm working in one of the largest healthcare sector of Western Sydney Local Health District here in Australia as an RN and also in an aged care setting. So I'm really proud of it and I am proud that I overcome all those obstacles. So today I'm just gonna share those experience and I want to guide you how to start your first shift as an international RN in Australian healthcare setting. First of all, I would like to congratulate you that you have come this far and now you are in the process of joining the Australian healthcare setting, that you have passed all those OSCE and NCLEX examination and all those nightmares which were really difficult. So when I talk about this, I know there is always a second thought that comes on your mind. Even when I joined the Australian healthcare setting, I doubted myself. I was like, I only have experience in my home country. Do you think I can join? How am I gonna start the job? Like, how will the job look like? I understand all those fears and all, but remember, you have passed the Australian standard OSCE, which is not easy, and because you have passed those exams, then that means you are good enough to practice already in Australian healthcare sector as a registered nurse. So do not forget, okay? Okay, so now I'm gonna talk about how does the workplace looks like when you first start to the overseas RN. I know, most of us have already worked in overseas, but there because like OSCE and NCLEX can be also given by those who do not have an experience, then they might face a bit of difficulty when you start the whole new journey without any clinical back experience in home country. Then it's a little bit tricky and tough. So I'm just gonna overall focus on the things that you need to do before you go or before you get ready for your first job. Okay, number one, if you have already got the job and it's your first day tomorrow or in a week, that you are going to start your job, then you should revise your clinical skill. I know we already have lots of clinical skill that has been practiced in our home country, but I want you to watch the video that are based on the Australian healthcare practice setting. You can go in the NSW government health site where you can watch various kind of videos that are related to the Australian standards and policies. When you do these clinical skills or when you repeat this clinical set of skills, then it's easy for you to implement it in your daily practice when you start your job. And also remember, you have practiced all these skills when you were doing the OSCE examination. So it's kind of like revision that you are just doing before you are going in your real job. For example, you can practice the IM, subcutaneous injection or intravenous injection, or you can also practice oral medications. You can go through the pharmacology. You can understand that you need to make a note that what kind of medications are high risk medications that are considered in the Australian healthcare setting and what kind of medication does need the double check with the RNs and or about the S8 and S4 drugs, and also about you can also practice dressing and vital signs that you're gonna do. And you can also practice the communication, especially when it comes to an international RN. Communication can be a barrier, so understand how to give and take handover in ISPAR technique, which you have already learned in OSCE. So practice it at home so you do not have to hesitate when you are actually doing it in your real life. Along with the clinical skills, also learn about the Australian healthcare practice and standards. I have talked a lot about these standards and practice in my previous videos as well. So it like hospital setting and aged care setting have different standard and practice. So go through, like, depending on where you are working, then you can decide which standard or practice you need to learn. Okay. Number two, prepare your materials. So when I say prepare your materials, you must have already know it's about basic things that you will need, like good attire or your uniform or any keys that has been given to you, or any kind of like notebooks, pens, markers, all those basic things, water bottles, your lunch, yeah, all those things. Prepare ahead so you, like, your stress level is low. And along with this, remember, when you go in the orientation or on your first day of the job, like, be open and then communicate with everyone, like, it helps to make you ease and also helps you to build the confidence. And do not reach late. If you do not know the area where you are gonna go, then go a day ahead. So watch around, like, find out the parking areas, or like, main entrance gate, everything where the place the training is or the orientation is, so it's easy for you. These minor things can be like, if you be ignorant on those minor things, then I know it may stress you out when you are already stressing out, because it's your first day. So I suggest, be mindful about these small things because it helps to reduce your stress. Number three, when you are working in an Australian healthcare sector and it's your first day at a new job, then usually they provide the body shift. And if you are not provided any body shift, and because your manager says, okay, you're going to have to work by yourself on the floor, please request your manager, can I have a body shift, because this is my first job, or something like that. Or because you can also tell them, like, because I do not know the place, I do not know your policy, I would like to have the body shift, and they will definitely provide the body shift. They won't say no to you. So when you go in a body shift, the person you will be working with is also of the same role, that as of yours. So learn from them, see how they work, see how they start their day, see how they spend their day, and make a note. Please make a note. The body shift is usually given so it's easy for you to adopt in their work culture. You see how they work, how the working environment is, and how the work culture is, and also like how the tasks are, and what kind of task you need to do in that workplace. So when you do a body shift, I suggest make a note of the things that the person do on a day, like, what kind of work they do, how they start the day, like, for example, if you work in an aged care, we usually go and look at the communication book first, like after getting handover, and go in my round and something like that. So like observe what the person is doing and ask the questions. Do not forget to ask question if you have any doubts. Okay. So those are the things that you need to prepare and get ready for the first day of the job. Now I would like to talk about how to start your day on a first day of the job, because you may not know anything. And if you are directly from here, from coming from overseas, and you have been placed as an RN, or you got the job as an RN in that new place, then you may not have any idea what you're gonna do, right? Yeah. So in this case, I would just like to let you know, like, when you because in Australia there is two general settings in healthcare. One is aged care setting, and another is hospital setting. These two are the most common, and I'm going to talk about today because I work in both sectors, so I think it's easy for me as well, and to share my experience. So first of all, I would like to talk about the aged care setting. So when you reach in aged care setting, or when it's your first day, or when you are coming from the agency, then first of all, ask for the orientation. So usually, when you reach, or when it's your first day at the job, then even if you're working from the agency, or you're working as a casual pull RN or anywhere, then they usually have the orientation checklist, or like, induction, something like that. So it in here, so it's easy for you. So this kind of papers includes all the details, such as, like, where is how to do the facility tour, or like do the facility tour at first, and then know the resident areas, know the staff, staff areas, where is the staff room, where is toilet, where is nursing station, where is treatment room, where is pan room, that is dirty utility room, and where is kitchen, everything, like that way you will be needing for a whole day when you start the job. And then it will also include everything like general, such as security system, swipe cards, logging out, faxing machines, like manual handling machines, or what are they. And also they will give you the policy and procedure. Usually every place that you work on have the written policy and things, and like they have a booklet, so it contains all the information that you will need for when you work in that workplace, such as any medication, if there's any medication mishaps, how to manage them, or any kind of incident happen in the place, and how you're gonna manage it, any kind of infection outburst, how you're gonna manage it, and any kind of mandatory reporting things, then you're gonna have that policy as well over there. Similarly, they also have the new admission policy, everything. So usually if especially working in an aged care, if you are from agency, or even if you are working as a first day on that new job, then you can ask them for this kind of orientation checklist. This checklist will help you to tick all those things, and you won't miss anything. So it's easy, and easy to remember, and easy to carry for you as well. So for the next day, it's gonna be useful for you. And also, when you are doing the orientation part, make sure you understand where are all the emergency equipments kept, such as oxygen, suction machine, or any kind of other life-saving devices, emergency medication, nurse-initiated medications. Make sure you ask them where they keep it, and also the first aid boxes, so it's easy for you. And also, depending on what kind of shift you're gonna work, furthermore, like if you're working PM or nights, then there won't be any managers on site, so ask them about the after hour policies, and like what kind of after hour policies you have, like what kind of after hour contact information you have. Take a note and always carry that booklet with you, so it's easy for you whenever there is any kind of emergency, especially in aged care setting, because you will have to look after, like 54 residents, or like 20 resident, 24 resident, and you will be in charge of the place. And if you do not know those after hour emergency services number, then it's going to be very difficult for you to do your job. So I suggest every time you are in a new job, or like you are from agency, always ask about the after hour service numbers. Okay, when you are in a hospital setting, it's more easier in regards of this after hour services, because you have after hour GMO, you have team leaders on a shift, you have, like other colleagues that know the place very well. So in hospital setting, this kind of things may not matter, but in aged care setting it matters. So make sure you know where they keep all their policy booklet, where they keep all their after hour numbers, and all the fire exits and the fire assembly area. And after getting all the orientation of the area, prepare for your handover. So when you take the handover and it's your first day of the job, or if you are from the agency, you need to ask few things. Because when you work in an aged care setting, I already told you the ratio of the resident and the nurse is very high. So you may not have time to go in each files or in each resident's profile to check what is due for the day, or what kind of medications they are on, okay, or what kind of insulins they are on. So when I work as an RN from agency, or it's my first day of the job, I always make sure I ask these questions. So you can also make a list. Number one, ask them if there is any important thing that I need to do today. Okay, any kind of important thing that you need to do today. And ask them if there has been any incident prior day on their shift or before their shift. It helps to understand you high. It helps to give you the overview of the high risk resident. Ask them if there has been any fall incident. Ask them if there has been any source incident. Ask them if there has been any negligence or any medication in like incident. So it helps to like understand you what's going on in the home. Okay. Number three, ask them any resident who are on insulin. ask them who are on any kind of S8 or S4 drugs, and ask them if there's any kind of other PRN medications that, like, that may be used for any kind of behaviors or pain, and ask who are on blood thinners. So you need to ask these questions because you won't have any time to go separately or individually on the medication chart and find out who is on insulin or who is on any things. If you have, like, make up your mind beforehand, okay, these residents are on insulin and these residents are on as for acid drugs, then it helps you to prioritize your time as well, and ask them what time they are due on, like morning, breakfast, lunch, like dinner, or what time, and ask them which residents need to be, like, given special care. This kind of thing is important because when you have already high ratio, you may not have time to go and do your things one by one, so you need to prioritize your task. Okay, so these things are important. And when you miss those asset and as for drugs, it is considered as negligence, and it's gonna be another incident that's gonna be made for the day. So, like, why to, like, why to just neglect it, or why not to ask, rather than just going by yourself individually. You can ask, but you can always, like, cross check if it's correct or not. But I suggest it's easy when you ask and you do the cross check. But do not solely depend on that. When you do your medication, then of course you will find out as well. The thing you need to ask the number of resident living in a place, and also ask them who are high fall risk, who are on high risk medications, and who are also, like, need what kind of assistance in terms of their mobility, and ask them who are on cross medication. Also ask, like, if there's any special demand from any kind of resident for their medications or any kind of cares they want to receive, because when you talk with those regular RNs working on the floor, they usually know, like, what the behavior of the resident is, and what, like, what time they prefer their things to do. So maybe sometimes there may be, you may find out the resident who do not want their medication at, like, 6 o'clock, but it's due at 6 o'clock. Then what do you do? So you need to make sure, like, and some residents are very, like, thing on time. Like, if they have 8 o'clock medication, they want exactly at 8 o'clock, neither 5 minutes delay or neither 5 minutes early. So you need to make sure, you need to ask those things, like, to those RNs, to those old RNs who knows about it. So it's gonna be, like, just making your day easy. And also ask about if there's any residents who are on the drains, who have tubes, or who have, like, SPC, who have IDC, or any kind of chronic dressings, or any kind of, like, active life-saving devices or anything like that. And second, so once you reach to the workplace, check the communication book. Always check the communication book, because so I will show you before what the communication book looks like. So most of the place have this kind of communication book, like you can see. I will also put the screenshot in there. So it has got the dates and time on it. So when you open this date and times on it, it usually contains information what to do on a day. Like, suppose if today is November 22, 2024, then it will be written in here what are the important tasks that you may need to do for the day. Like, suppose this resident needs vitamin B12 injection, this resident has appointment today, this resident is coming from hospital today, this resident family wants to take them out today. So it's better for you, or even the important, more important, like, this resident have a fasting bloods today, so they cannot have any breakfast. So these kind of books you need to check as soon as you finish your handover, because these may contain the information such as fasting bloods and all, which may have need to do on a certain period of time. And if you check it late, then it may be late already, they may have already eaten their breakfast. So please, please, please bear in mind, this communication check, like, this communication book must be checked before you start any other things. Okay. And secondly, go in your round. So after finishing handover, after checking communication book, go on a round. So I always say go on a round and check each resident, because When you pass over or get the handover from the night shift, they may have done their one round, but you need to make sure all the residents are safe and alive, you know, because usually like this kind of incident happen in between, like in a handover or over the night. Some of maybe they're on the floor lying down, and then maybe they need to check on, and the care staff, they also do their round, but because they start to do their ADLs as soon as they reach there, they may not have time to go on all the residents room. So as an RN, you need to go in all the residents room and check and make sure all the residents are safe and sound before you start any other activities. Okay, work under your scope of practice only. Like if you do not know how to practice any kind of skill such as changing FPC or feeding via NG tube, then ask for the help of the manager beforehand, or like ask them to manage, or like provide you the CNC who can teach you to do those things. Or you can also go to another RN and ask them to do it, and then you can absorb the skill if they know how to practice it. But do not practice anything that's not under your scope. And if you do not know if it's if the particular skill is under your scope or not, then ask for the then look out for the educator or look out for the manager and ask them if that certain thing needs the competency or anything. Then you can confirm. After confirming, then you can, if you find out it can be done, then you can do it. Otherwise, do not do it. And like I said about the competency, if it's your first day, usually the home or the place that you are gonna work or do job, they will do all the competency tests that you will need it, so it's easy for you. And but if you are from the agency, then of course when you join the agency, they may have already done your competency, so you do not have to go on the home and then do it again. You can always double check with the agencies. So these were all the things that you need to consider when you work in an aged care setting. So now let's talk about the hospital setting. So hospital setting is a bit different when you work in compared to the aged care setting. So in hospital setting, of course, if you are going to permanently work there, there will be lots of educators around you who will like assess your competency and find out if you are well trained and if you need further trainings as well. But if you are from the casual pool, then it might be a bit different for you. You may not get body shift, because I did not get any body shift when I worked from the casual pool. So although I had an educator who did my medication assessment, so they did the 3 sets of assessment on me on for like 3 different days. So it was easy. So I was also I also built the confident level after that competency test. So when you work in the hospital setting, they will do all those kind of competency tests that you will need, like in the aged care setting. So you will do the medication administration like competency, and also the manual handling competency, basic life saving skills, training and all. So it's easy when you work in the hospital setting. And more of that, there will be lots of team, like colleague around you. There will be a team leader, there will be the after hour educator, or like on day educator, who can provide you or help you if there is any kind of new set of skills. But again, in here as well, you should not practice out of your scope. If there's anything that's out of your scope, always ask for the help from the TL or your colleague, and ask the educator to come with you so they can teach, and also they can provide you the competency of that certain thing. Okay, and if you again have the doubt in hospital setting as well, you can always double check with your team leader if that certain or particular skill needs the like competency or not. So usually when I work in the hospital, I always I always carry around the timesheet with me. I'm just gonna show you. Like here in the picture, you can see I've just put the screen so it's easy for you. So here in the picture, you can see I have made the timetable like 7 to 3. Like with start time to end time and number of patient I'm gonna get. Usually in hospital setting, if it's mornings, if you're gonna get the 4 to 5 patient, but in afternoon you may get up to 5 to 6 ratio. Okay, so if afternoon may be a bit difficult, but if you want to learn the things, the morning is the best, because in everything happens in the morning, like dressings and like any kind of procedures or any kind of things, it usually happens in the morning. So I think as in Casual Bull Arvin, I do the morning shift because I get to learn many things. And also, and make sure you receive the handover when you're working in the hospital setting or any kind of setting. Usually in hospital setting, I suggest you go and watch the patient when you take the handover. So ask your colleague to give the bedside handover. Okay, so it's easy, you can see your patient as well. When they give the handover, they say, okay, this patient have this drain, so you just go and check, okay, there is a drain, okay, it's intact, okay, it's good. So if they say there is a IDC, you see, oh, okay, there's IDC, it's draining well, okay, something like that. They say, see, I've got the IV cannula, go and see if they have the IV cannula or not. So it usually happens in the hospital setting, because I think in hospital, in aged care setting, it's usually routine things that they do. But in hospital setting, there will be always a change of the patient. So you need to make sure you're up to date with the patient, okay? And always do the bedside handover. I think I prefer the bedside handover better than just getting the general handover. And then when you take the handover, during the handover time, these are the things that you need to make sure you know about the patient. So the first of first, make sure your patient ID matches with your handover note, the name of the patient, the bed number, and the MRN numbers. Make sure everything matches before you take the handover, and then ask the full name of the patient. Ask them why they are there. Like, use the ISPA technique, of course, and use, like, what diagnosis they are for here, and what is the situation, what was the background, is there any other background health disease they have, like diabetes, hypertension, or anything. Ask them what diet they are on. Ask them about the mobility. Ask them about how fall, if the patient is high fall risk or not. And ask them what's currently going on, if there's any physio, social work review, or any kind of speech path review due, like any kind of procedure they have today, or any appointments they have today, if they are going to be discharged today, what's the plan for the day, like, and what kind of treatment they are getting, what kind of medications they are on. And make sure you open all the medication chart, and see if all those medications has been given on the previous shift. If not, why not given, and if you need to give it or not, ask them as well. And ask them the plan of care, like, what they are waiting for, if they are waiting for to be discharged, if they are waiting to be seen by the any other team. Ask them everything. And ask them about, like, if there is any fluid restriction. Also ask them if there is any access devices, such as central venous devices, or any kind of, like, intravenous devices, any kind of drains, any kind of chronic dressing, or any kind of like NG tubes, or any kind of extra drains, all those things. These all the things are, like, similar to the overseas nursing, but I just wanted to make sure, like, you do not miss these things on the handover on your first day, so you do not get panicked. Okay. And when you get the handover, in hospital setting, you need to go and check if the emergency equipment is working, if the oxygen is working. If the suction is working, it's similar to the aged care, and find out where the stocks are kept. And just like ask for the orientation of the place, like, before you start. And it also, like, it's more important for those who work as an casual RN and agency RN. So ask them about the orientation, which early. These are the common things that you also need to do in same in the hospital setting. And once you receive the handover, then you can use the time sheet that I showed earlier, and then you put the task on there, like, okay, you have got the meds at this time, you have got the vital signs to be done at this time, and everything. And you also talk with your patient when you give the handover, when you receive the handover. Make sure you involve them in the handover, and introduce yourself as well. Tell them you are the nurse for the day, and if there's any whiteboard, put your name over there, so it's easy for them to remember as well. I think these are the things that you will need to consider while you're working in the hospital setting. I hope this helped. So when it's your first day of the job, of course you're gonna introduce yourself, let them know that you are new in here, and then you are eager to learn and show the enthusiasm that you have, and be open to communication, make friends, like not kind of personal friends, I'm talking about the professional friends. Like don't hesitate to ask for the help, don't hesitate to ask for questions, and always practice within a scope of practice. So these are the things that you may need to do when it's your first day of the job. If you are working from any agency, or if you are working as a casual nurse pool and you do not have work in any healthcare setting before here in Australia and it's your first day. So I hope this video have helped you. And if you have any further questions or anything that you want to know, then you can put on the comment box, or you can also email me or message me, or you can also follow me on my Instagram and TikTok. I hope this video has been helpful for you, and I will see you in my next video. For now, bye.